So this is about kids and chiropractic, primarily geared toward mothers. We see a ton of children in my practice. That is my passion because we want kids to be and grow up as absolutely healthy as they can possibly be. And people wonder, gosh, how early should I start chiropractic care for my children? Is it too early right when they're born? And I usually kind of quip and joke and say, we usually wait till they're breathing. So it is true that a chiropractic evaluation, examination, and potentially adjustment from when children are first born can be absolutely critical for their health. People say, are you going to crack my baby's neck? We never ever crack anybody's neck, but particularly not babies. So they're tiny spines. This is an infant spine, a plastic version. Their tiny spines, when they're inside the womb, are very curled up in a tiny ball. If the mother's spine is misaligned, which is one of the biggest reasons that we take care of a lot of pregnant women too, but if her spine is misaligned, it can twist and distort her pelvis, which will twist and distort her uterus. So the baby's spine can be twisted inside the womb, and as the baby's being born, it's a very, very difficult process on mother and on baby. And then when the baby's head crowns, the doctors often pull or twist and jar on the neck. Gosh, that can be a lot of pressure on that child. What a chiropractor geared toward children, seeing children, what we do is we do very delicate palpation or feeling of the spine. We do neurological tests to see how the spine and the nervous system are working, and we perform very, very gentle adjustments if needed. They're not always needed. When they are needed, the pressure used to make an adjustment is about the pressure you'd use to check if a tomato is ripe. It's the tiniest, most delicate pressure, very specific, at the right place, at the right time, very gentle to just restore normal motion and alignment to those spines. Reminds me of a tiny child that I saw who was 9 months old and still weighed under 10 pounds years ago. And we made just the gentlest adjustment to his upper neck, absolutely restored life to him. His color returned to his body, young James, and he went from gray to an incredible, alive, healthy body. And that brings a joy that I can't describe. Or to think of, I have patients who have been coming to me for over 20 years. I think of Paul and Jill are their names, and they've been coming to me for since before they were married. Now they have 6 kids. I've been taking care of all their children since they were born. We just maintaining them so they grow up as healthy as they can possibly be. It's nothing that they're dependent on or anything like that. If they never got adjusted again, they'd be super fantastically healthy. But they want to be at the peak of their performance. When we train the spine in the way it should go and the way it should grow, when it's older, it won't depart from it. So in other words, if we can make sure the spine grows level and healthy and the hips grow level and healthy, and with regular adjustments for these children, they grow up as absolutely healthy and strong as they can be. We also give advice on nutrition and on sleep habits and on other things to help people just be as fit and healthy as they can be. We love taking care of kids.